Hello, dear friends, customers, and patients. I want to welcome you to Dr.O Solutions and Medical Ozone Therapy Group. My name is Oleg Nikishin. I am ND and Master of Science, but people simply call me Dr.O. In this particular video, I would like to show you how to do bagging and cupping. But before, I need to disclose the few things about ozone therapy. The ozone therapy is medical therapy that has been used worldwide for more than 50 years. But however, in FDA regulations in US and Canada is not recognizing ozone therapy as medical therapy. For that reason, I have to make a disclosure. However, ozone is considered to be as a grass, as what they call is generally safe to use for food industries in United States. Second, as you know, ozone can be very harmful substance in the large concentrations, and for that reason I would like to tell you always use OSHA safeguard and the OSHA requirements for safety. And here is a typical OSHA requirements for ozone safety. Just let me remind you that the OSHA, as you can see, OSHA requirements is 0.2 ppm and 0.1 ppm, depends on exposure to ozone. But we, as humans, we can sense ozone in much lower concentration. So that means if you smell ozone, we can smell ozone almost in 0.01 ppm concentrations. So if you have ozone, you smell ozone, don't necessarily mean there is 0.5 ppm in the air. So we can smell, our ability to smell ozone is much higher than OSHA requirements. If you are concerned for the ozone concentration in your room, please always use ozone destructor, and I'll show you how to use it later on. Okay, let's go to this particular topic that I'm going to cover right now, is cupping and bagging. But first, again, go back for the first video. In that video I presented to you how to use and what concentration of oxygen has been used for ozone therapy. In ozone therapy, you must have oxygen to produce medical grade ozone. And most of concentrators in medical oxygen in the tank or in the industrial tank has more than 85% in oxygen flow, which is USA requirements, and they round between 95 to 96 oxygen concentration within the gas mixture flow. So here is what we have, Dr.O Solutions ozone generator. Okay, the concentration chart is over here for you to see, and what we did, we designed that unit mostly for and around therapies. Let me explain that more in details. So the ozone concentration measured in gamma, and the gamma is milligram ozone concentration per liter flow. So it's a concentration within a flow, not the pressure. So some people ask me about the pressure. It's not the pressure, it's the flow. So in that chart, as you can see, we round everything from 1/8 liter per minute and 57 gamma. This is most of the time, that flow used most of the time, many different applications. Even for the blood ozonation or the bagging or sometimes in the capping, this is typical and kind of most efficient concentration that can be used. Okay, let me start showing you how we're gonna use cupping. So what is ozone cupping? It is a simple silicone medical grade cup. So what we do, we connect the cup to the output port on ozone generator. Okay. We open up the valve of your oxygen tank, and we set up for 1/8 liter per minute, for instance, from the beginning, because it will take a while to oxygen to fill up the line, because 1/8 liter per minute is still small setting. So, and we turn the ozonator on. Now, let me grab something else. And now, already ozone is coming up. So I reduced to 1/16 liter per minute and then down to 1/32. And the reason for that, there is ozone already coming out from this cup, but very small fit. I can already smell it a little bit. So then you apply it to your areas which you intend to treat. Okay. First, what you have to do, you have to wet your skin and simply apply, since you can smell ozone, so I put it at 1/16. Again, this is very little flow, and apply it to my skin. Well, obviously not going to do it on arm, it's just my example. And you keep it for 10, 15, even sometimes for 30 minutes. Okay. Why we develop the cup? So alongside with bags. Because bags is for most of the time, that's for the limbs, for the arm or leg, foot, you have hand. In other words, that you can be enclosed completely in bag completely. So the cup you're going to use for the areas that you cannot enclose yourself, as your body or the head, for instance. Cup, most of the time, people use topically for topical application as they have a back pain. And the back pain, if you do, for instance, rectal insufflation or any other insufflation, you do genetic treatments of it. First of all, ozone gets in the bloodstream. Before it gets to your local area of your pain or inflammation, your body will use that ozone very rapidly. So ozone will be converted by capillaries in oxygen. And there is enzymic reaction that will convert ozone to oxygen almost immediately. So when you do treat your ozone, you make ozone therapy and to treat yourself systemically, ozone is not going to get to your local areas, whatever local areas of pain. When you do topical application with the cup, ozone penetrates through the skin, goes directly to the area of your pain. Is it back pain, shoulder pain, any very good, any lymphatic, you have inflammation, for instance. It's very good for the lymph nodes. So lymphatic, if you have lymphatic stagnation or something, there's so many different applications. There is various different applications. Again, this is very safe, very effective. Second is, we discovered it's extremely effective on insect bites, tick bites, bee stings. So I tested and I have a video for it. Hopefully we will edit it and put it on YouTube, how I kill tick with this cup. Tick got dissolved completely. Tick dissolving, like it goes in the water within 4 minutes. So if you have a tick bite, immediately you just put the cup over it and it will treat the whole area around it, and the tick will be completely dissolved. You just scrape it out. That's what we did. So that's how many different applications of this ozone cupping I can't even imagine. People tell me so they have very successful application for the ringworm. very successful treatment of the scabies. Scabies is a different story. It's extremely difficult because that parasite lives under your skin. So that's the ozone cupping. Okay, if you have any more questions, please ask under this video in comments. Send us your questions, and we will be able to answer it. You can do it on the Facebook page, our Ozone Research group on the Facebook page. I'll talk about this later. Now, let's move on to the bagging. Okay, next slide, please. Here's the bagging. We developed few bagging solutions. We have 6 different varieties of bags. As you can see, this is a hand, this is a foot, and we have a leg, we have arm, we have junior leg, and we have junior arm. The reason why we have adult and junior, it's the surface diameter. In other words, the kids or small ladies that have small limbs, so that's why we need a different diameter of the surface, the opening. So let's go back to the leg. This is leg. So what you get large diameter. If the bag is, if opening in the bag is too small for you, it's very simple to do. You just take the magic marker, you mark around the circle, you take the scissors and cut the opening. Make sure so you don't cut membrane crosswise. You just make an opening for yourself, and bag will sit tightly on your leg, and will not allow ozone to escape. So there is bagging solutions for limbs. What's a bagging is most time is used for? It's any application of the limb pain. Any pain. Ozone bagging takes pain within about 5 minutes. If you have diabetic ulcer, if you have insufficient blood flow to your limb, if you have nail fungus, this is extremely helpful, the hand. Okay, but for nail fungus, we develop ozonated oil antifungal with the special substances that pull fungus out of your nail. But when you apply this overnight, and you should apply it overnight, you probably wake up in the morning with inflammation over your nail. And this is very common because the whole inflammatory process is a recovery process. But after that, you put your hand in the bag and feed ozone, and that will take inflammation completely out. Okay, let's start going, and I can show you how to do the bagging. It is a typical hand bag. It has a connector, barb connector, and it comes with a 5-foot medical silicone grade tubing with a male lure connector. Male lure connector sits directly and ties directly to the top. Make sure this is tight. So you make sure don't over tighten it, but make sure it's tight. Again, we recommend I open up about 1/8 or 1¼ liter per minute. The reason for that, you have to start filling up the bag. Turn generator on, ozone starts flowing. I usually test it this way, but if you're afraid, you shouldn't do that. Okay. Now we attach other side of this hose directly to the barb connector. Okay. I spray for instance, this is my arm. I have assume, let's pretend I have a carpal tunnel. So what I will do, I will spray water over it, moist my arm. Okay. The reason for that moisture absorbs ozone rapidly, and arm pulls the moisture in. And simply put my arm over it. As you can see, it sits very tightly, nice and tight. Very simple. So what I usually do, I increase the flow. I'll increase to the 1/4 liter per minute. For the shortcut, let's do it 1/2 liter per minute, and I can see it's flowing, and you will see the bag will start inflating. Okay, there is ozone coming in. As soon as bag inflates just a little bit, I usually reduce the flow to 1/8 or 1/32 liter per minute. The reason why I do that, because I want to have highest concentrations ozone in my bag. And again, I even can smell ozone, but as you can see, it's already inflating. There is a lot of ozone inside. And such a high concentration and low flow allow not bag to overinflate. In other words, bag will be almost always underinflated. But over here you can see it can be inflated up to this. It's especially made that picture so the people be able to see it, that it can't hold the pressure. As you can see now, it's inflating, and I'm just holding my arm. So you see, so it's good. So I don't want it overinflamed. Even though if it's overinflamed, you just simply can open the cuff, get ozone escape. You see, I can smell it, but it's safe. The concentration is not that high in the air because we have a high ceiling. So, and I sit and wait for, usually typical procedure is 20-30 minutes. Sometimes when you have acute trauma, and it happens many times, people report to us. It happened in my family, in my assistant family. It happened, that's what you step over something, or you strain your ankle, you almost make the damages to your joint, and sometimes joint could be so badly damaged. Again, we're not talking about the bone fracture, we're talking about just simply straining of the joint and tendons. So when you have even sometimes area could be yellow, the bluish, that's what happened. So we put ozone bag over it, and that reason, with my wife, when she slipped on the wet floor and fell off, it couldn't get up even. So it was badly ankle. She has a strained ankle. So I rush in and put your leg in the bag, and she was sitting for an hour and a half. After an hour and a half, bluishness of the ankle completely was gone, and she'd be able to walk. It was painful, but she'd be able to walk. So I can continue bagging application twice a day, 3 days in a row. In the third day, she is already normally walking. In the other, if I wouldn't scenario, if I would not use ozone, that usually recovering time up to 1 month. That's how usually it takes to joint and tendons to recover. So as you can see, the bag is inflating again, and I just sit and enjoy my therapy. Or your patients is what you do for your patients. Okay, let me shut it down. Just an example. Okay, this is bag. You just pull it out. As you can see, arm is wet and reddish. That means there is a lot of ozone in. So, and here's a bag, a lot of ozone coming up. Now, if you're concerned about a lot of concentration of ozone, you simply just can shut it down completely and sit another 10 minutes till ozone concentration reduces substantially within the bag, because ozone kind of goes back to oxygen, but then in the air it's about 20 minutes. And this is the arm. It's multi-use, so what you can do, you just can do this and just dry it out, because it's going to be a little bit wet. Now, ozone is disinfectant substance, so don't be concerned. There is some germs that are going to stay in. Nothing can survive that kind of concentration of ozone. Okay, this is an arm. This is a hand bag. The same procedure with the arm, but the arm will cover whole your arm. The same thing with the foot. Have a foot, and the same thing with the whole leg. As you can see, it's almost we cover almost whole leg coverage. On the leg, we usually set up high flow, about 1/4 to 1/2 liter per minute, because it's a very large area. So the bag is huge, and you're not going to fill up bag even you keep it under the quarter liter per minute. It's such a high volume, such a big volume in the bag. So what you can do, you start with a quarter, even half, till you have bag a little bit inflating. Then you switch back to 1/8. That's what we usually keep it at 1/8. And again, bag is not going to inflate even the whole leg, but will be a lot of ozone inside. But you're not going to be able to smell it outside, but will be a lot of ozone inside. Sometimes because the bag contains a more volume of ozone, so what we do 15 minutes prior end of the therapy, we shut down completely feed and have ozone stay inside. And simply ladies or men can just relax and do whatever they usually do. Sometimes people sit and read the books and enjoy it. After 10-15 minutes, concentration will be reduced substantially, and you can safely pull out the leg and just dry it out. You can wash it and reuse it again. If you have a clinic, if your patients don't mind, you actually can reuse it, because as I said, ozone is killing all bacteria, all viruses, all fungus inside in the bag. So you're not going to see any fungus buildup or any other substances build up. Okay, last thing I want to point out, because some people asking, if you do have many different applications, and this in particular applications will be as rectal insufflations or transferring ozone to bags and to the blood ozonation, but this could be too, by the way. So how to use and what is it this destructor is for. So this is destructor, it destroys ozone, and how we do that is very simple. You use 3-way valve, you attach 3-way valve to it, to your port, just like that. As you can see, it points out how the flow goes. It goes straight and goes to the left. So you put your destructor on one port, for instance, assuming, and you put output, that could be the bag or could be the cup, for instance, if you just want to do multiple cupping, and this will be good application, and you just afraid that ozone is going to leak out. What you do the same thing. You start, but you switch flow direction up. So there is no port on the right, so there is no ozone coming to the right because it's blank. So now ozone going straight. Now we turn it on, and you do cupping. You do cupping, but you're afraid that you transfer cup to the other site treatment, you have ozone coming out. What you do this way. You point out ozone to destructor, and you can't even smell ozone. And there is no ozone coming out because it's a blank. So till you rotate the patient or do something else, there is no ozone coming out. You apply it to it, it's ready, so you turn flow up again. There is no outlet on the right, so ozone is not coming out, and this is shut off. This side shut off completely. Now ozone coming out. That's how you use 3-way valve, and what is it used for. So it's a handy piece, and we recommend using it, ozone destructor and ozone, let me point out, so there is a lot of ozone coming out. So now it's, as you can see, nothing coming out because it's stopped, and it's all ozone coming out to destructor. Okay, let me shut this down. So next slide, please. So we have Dr.O Solutions Medical Research group on Facebook. That's a closed group. You have to ask to join. You just click allow me to join, and I will so approve it as you to be a member. Then you can share your experience, you can ask the questions. So again, it's a closed group. It's not for all open public to see, but I think this is best and a good group for you to join in. So we have Dr.O Solutions on the Facebook as well. That's we always bring the new blogs and topics and cover other interesting topics. So you don't need to ask to join it, you just simply click I like it, and so any new updates you will be notified and you will be able to see it. Now, please, again, we would like, did that group and would like to bring it to your attention. So this is ozone research from people to people. Would like you to share it, especially if you're professional or if you have positive experience in ozone therapy. Please share it. Have other people know it and share your success with it. So far we have quite a few interesting shares and interesting stories throughout the world, because we ship the product all over the world, really. So please share. Please engage. Engage. If you don't know what to do, how to do it, or if you're concerned, you're confused, don't afraid to ask. We always answering all the questions. So if you need to contact us, so here is a contact form. You'll be able to call us or email us or simply go on the website and even engage on the website. If you like our product, please give us reviews. Tell us what you think about it. We would like to know the feedbacks, because, as I said, all the products has been developed in our clinic for professionals and people like you. It's simple to use. It's the best thing we try to do is to make it simple in application and simple to use. Okay, that's all, folks, for this video. See you next time.